A little bit about what this is today that I'm sharing. I'm actually a PhD student in the School of Nursing. As they mentioned, I'm a nurse, and my passion for CF research comes from being a bedside nurse. And so basically what I'm presenting to you today is a portion of my dissertation data. So I actually do not defend my dissertation until June. So this has not been published or anything. So this is actually brand new. This is the first time that I'm presenting it. So the title of my presentation today is Health-Related Quality of Life and Body Image in Adults with Cystic Fibrosis. Just a little background. Overall, females with CF consistently report a poor overall health-related quality of life. However, males actually report having a poorer body image than females. And in the literature, it is supported that a lot of this is due to cultural norms in part. So while it is culturally acceptable for a female to be very thin, and that's actually what's promoted in social media and TV and things like that, males actually want to be taller and more muscular. Also, just to dig into this a little deeper, females tend to be more satisfied with being thin. However, thinness can actually contribute to poor long-term outcomes. And in terms of males, they tend to be dissatisfied with small stature and low BMI, and it can actually lead to psychosocial expectations that are not attainable for them. Also, having a negative body image is associated with higher rates of anxiety and depression. But those who perceive their body image as positive are actually less likely to comply with nutritional interventions aimed at getting them to gain weight. So my dissertation study is part of a parent study, and the title of the parent study is Coping and Health in Adults with Cystic Fibrosis. And it basically is looking at how people cope with CF, and also looks at different coping styles that can contribute to health and well-being. So 123 participants were included in completing a health-related quality of life survey. All of these participants were recruited within the UAB health system, so that's both inpatient and in the outpatient clinic. And then I actually conducted 30 follow-up interviews that were done based on prescribed medication. So that was a parent study inclusion criteria. So in terms of my specific project, the purpose of my overall study was to better understand gender differences in health-related quality of life through exploring gender-specific facilitators and barriers to overall quality of life. The goal of administering the survey was just to examine the gender differences related to the different domains of quality of life by administering the Cystic Fibrosis Questionnaire-Revised, which, if you're unfamiliar, that is just a disease-specific quality of life questionnaire. And then the goal of the interview, or the qualitative strand, was just to build upon the questionnaire results to better understand the greatest gender-specific facilitators and barriers of health-related quality of life. So the design of the study was sequential, and basically all that the top line means, which is kind of confusing, is that I administered a survey and then I followed that up with individual interviews. The data that we actually collected with the survey included some data from the Cystic Fibrosis Patient Registry. So that included lung function values, reports of anxiety and depression, and some sociodemographic factors, as well as the Cystic Fibrosis Questionnaire-Revised and a demographics form. And like I said, 123 participants were part of that portion of the study. And then we did 30 individual interviews, which we were lucky to be able to split equally between males and females. So just a little bit about the Cystic Fibrosis Questionnaire-Revised. It includes 12 domains of quality of life, one of which is body image. So I'm about to present that portion of the data to you. There were 50 total questions, and this questionnaire is actually validated in over 30 languages and is the most widely used disease-specific health-related quality of life instrument. And in just a second, I'm going to show some of my data, so just so that you're a little bit familiar with how that's scored. Each specific domain has its own score, so body image also has its own score. And they're reported from 0 to 100, with 0 being the worst possible quality of life and 100 being the best possible quality of life. Just a little bit about the specific sample. I had people included in the study that were anywhere from 19 years old to 67 years old, but the average age was 31 years. 40% of the sample were college graduates. I tried my best to get half and half between male and female, but there were actually a few more females, with 54% being female. 43% were unemployed, while 32% worked full-time. And then 44% of the sample was married, while 46% were single. What is very interesting so far in the specific data is that a negative body image, it tends to be correlated with higher rates of anxiety and depression. But in this specific sample, that did not always hold true. So when we had males in the study, just because they reported a negative body image, they did not necessarily have higher rates of anxiety and depression. And it was opposite for females. So for females, they actually did have higher rates of anxiety and depression if they reported a negative body image, which is actually a very interesting finding. Also, rates of depression and anxiety were higher in females, but the difference in the depression rates were only, it was less than 1%, but females actually reported a 7% higher rate of anxiety. These are the CFQ-R results, and basically each bullet point here represents a different domain. And so for the sake of today's presentation, I won't go into details about every single one of them, but you'll see that one of them's body image, and males actually did report a poorer score in the area of body image. But what's so interesting is that in the 12 domains, males reported a poorer quality of life in 3 domains, whereas females reported a poorer quality of life in 9 of 12, which is also very interesting. And here are the actual scores. So you'll see here that while females did report a poorer quality of life in the area of body image, the difference, males reported a poorer quality of life in body image, I apologize. But the difference was actually not much. It was less than a point, which was very interesting. I honestly thought that the body image difference would be greater. And in a preliminary sample that I analyzed, the difference was greater. There was about a 5-point difference with males reporting a poorer body image. But once I analyzed the full sample, it actually closed the gap a good bit, and there's actually less than 1 point now. Once I elaborated on the questionnaires with the interviews, I asked again about body image. And so I basically just asked them how they perceived their body image. I asked them to provide kind of an example. You know, if they said it was positive, I asked them to go a little deeper into that, and the same with negative. And then once they gave me that information, I also asked them, you know, if they reported a negative body image, what has helped them? Or what do they feel like has contributed to their negative body image, just to get a little bit more information in terms of those facilitators and barriers. So in the interview data, it was very, very consistent with the survey. So males actually did 8 reported a positive body image, whereas 9 females reported a positive body image. So it was still very, very close. Males still reported a more negative body image, but just like the quantitative results, it was very, very close. So now I'm just going to share some of the participant comments. And as I share the positive male comments, I just want to also note that I literally dug through the data and looked very, very hard for a positive male comment, where when they said that they had a positive body image, when they actually spoke about it, it was more or less a neutral body image. They said, you know, I just don't really, I've never really thought about it. It's not really a big deal to me. You know, I don't think it's bad, but I don't really think it's good either. And then the one actual positive comment that I found, which is the top bullet point, he still mentioned that even though he didn't have a problem with it and he thought it was good, he still would like to have more muscle definition. So he said, overall, I feel like I'm normal in how I look and how I see myself. The only other small complaint that I would have is I would like to try to get into a workout routine a bit more and, you know, have some muscle definition. And that was literally the only very positive male comment that I could find. In terms of negative comments, many of them either talked about the fact that they wish they weren't so skinny, or that they wanted to gain weight. So one of them said, I've always had a negative kind of view of my body image just because I've had so many surgeries when I was a baby and kind of left a lot of scars on my stomach. I haven't always been the biggest kid. I've always been pretty skinny. And so I've always kind of had that negative view, honestly, of my body pretty much my whole life. The second guy went into a little bit more about the skinniness. He said, you know, when I asked him about his body image, he said, well, my body image doesn't really bother me, but my skinniness bothers me. And so he said, the skinniness, yes. When I look at myself, I look like I'm a toothpick, no matter how much you work out, how much you eat. I drink protein shakes. No matter what you do, in my eyes, it's been that I'm skinny and there's nothing I can do about it. And then the last one, he went into the fact that he doesn't feel like others see his body image as negative. So, you know, he said, I've never had any problems there, but it really bothers me internally. And he said, other people don't care, I guess, but it does bother me. I'd like to gain weight, you know, not look like this, but it's hard to. And so here are the positive female comments. And what is so interesting about this, which, you know, being a woman, I think a lot of this is just being a woman, but they would mention that they were happy with their body image. And when they went into detail, so many of them said, well, you know, my healthcare provider really wants me to gain weight, but I like the way I look, so I don't want to do it. And so the other thing that women tended to report is that they kind of just avoided their body image. So they were neutral, but at the same time, they would say, I just kind of avoid thinking about it. Just like the top one. She said, I don't have a problem with it. I used to be really little, and then I'm the only one who's always trying to gain weight. I don't look at it. I just say it's fine. And this is kind of interesting. I put this second bullet point here because I thought it was very interesting that the male said right the opposite about the scars and the surgeries. But she said, I'm proud of how I am. I'm proud of all the scars and all that because that just shows the stuff that I've been through and I'm stronger now. And then the last one is just illustrating the point that I was just discussing about the healthcare providers. She said, well, my doctors always say like, oh, you're too thin. You need to put on some weight. And, you know, I am pretty thin, but I don't think that as a negative. My mom was always thin when she was my age, so I don't let that bother me. They're always shoving weight down my throat. And, you know, I just have to accept me for who I am and what I look like. And I don't really let that, you know, bother me. I think I'm pretty healthy for my age. I mean, I have overall good body image. Some days I'm like, oh, I need to work out and get toned, but that's just, you know, being a girl. And so I thought that was interesting, just, you know, that multiple people or multiple women brought up the fact that their healthcare provider really wanted them to gain weight, but they did not want to. And in terms of the negative female comments, this is where the interesting data really came. The interesting findings that I found here were that when females talked about the negative aspects of their body image, almost all of them reported either having issues with bloating and or digestive symptoms that really affected their body image, whereas neither one of those things got brought up in males at all. And also when they did talk about gaining weight for reasons that they couldn't control. So I had one participant that was post-transplant and gained weight from being on the steroids. And then I had a few that actually were on Orkambi, and it caused them to gain 10 pounds or more. And all of them actually reported that negatively impacted their body image. They would say, you know, I'm healthier. That's good that I gained weight, I guess. But at the same time, I didn't want to gain that weight, and I don't like my body now. So just to kind of highlight some of the ones that were very interesting. The top one is actually from the participant who was post-transplant. And I asked her how her body image was both before transplant and after. And she said, before I had a really good body image. And then I said, well, how is it after? And she said, yucky now because I gained all this weight from prednisone. I have stick legs and a round belly. The second one is actually from a female who was on Orkambi, and she said, I guess after I started Orkambi, I gained probably 10 pounds or so. So my my image of myself isn't what I'm used to it being anymore. And it's been harder to adjust to that. I just am not generally happy with what I see in the mirror. And so I just thought that was interesting, that even though she feels like her health was really a lot more stable and she felt better, at the same time, her main negative side effect of the medication was that, you know, in her words, it made her fat and she didn't like it. You know, she was used to her body image the way that it was before. Another woman said, I think maybe like self-conscious and worry probably affects women more than men. We were talking about the bloating and stuff. I think that affects women more. Another female kind of talked about that, and she said, I think that I'm not a typical CF looking female. I probably have a lot more curves and fat than normal. So I don't, if anything, I actually wish I was a little more thin. I know it's not what the doctors want to hear, but you know, I'm also a female that doesn't want to be, you know, bigger. And the second to last quote is actually something that really talked about the bloating and really brought that point home about how that is very, you know, harmful to females to have the bloating and what they called the CF belly. She said, that's probably one of the most sensitive areas. I have always had more digestive issues than lung, and so it's created some bloating in my stomach. And even now, I mean, I'm 28. They're still trying to figure out the correct dosage for my Creon. So I've always had bloating. So, I mean, since like the age of 14, I've always gotten asked like in public, oh, are you pregnant? And when are you due? And so that's probably my sensitive spot that's always made me very self-conscious about my body. And so basically, the last one is just another female who is on the heavier side. She said, I'm actually on the heavier side, so I think that's helped me maintain my health and keep the healthy lung function. I'm not particularly proud of being on the heavier side. So body image wise, you know, I'm thankful where I'm at, but I wish I could weigh less. And so even when being heavier, actually, they felt like it helped their health, it harmed their body image. And then the other very interesting thing was just the bloating and digestive symptoms that did not come up at all with males. And so what do they do? I just asked them, I let them talk, and I just said, well, what do you feel like helps you? And of course, every single male, the first thing out of their mouth was, you know, strength training and weights. This particular male said, and that kind of helps me build some more muscles and maybe get me a better physique going. I usually, you know, I don't walk around with my shirt off. So it's the little things that I kind of hide, so to speak, but it makes me feel better. So that's what I do. And exercise was also a theme in females, which I'll get to in just a second. But also spirituality showed up in both males and females. But this particular male said, I got my blood sugar under control, and I started making sure I did all my medicines. To be honest, a lot of this is tied into my spiritual testimony. I know I'm not really here to tell that, but they're tied in. When I changed my mindset from me-centered to what I would call a more godly worldview, trying to love him and love others. And he said that that was really what helped his body image. Another thing, and this is actually only in males. Males constantly talked about because they wanted to build muscle. The first thing they said was, I want to eat more. I want to eat more protein. I want to eat less fat and, you know, take more supplements to try to build muscle. And of course, eating more never came up in females at all, which was to be expected. But this particular male said, just the protein shakes. And I mean, I eat, you know, a lot of protein. I eat, you know, 4 or 5 chicken breasts. And he went into this big long thing about his workout diet. And so it was very interesting, the difference in the eating habits of the males and the females. In terms of females, I have 2 here. The top 2 were ones that were themes in both, and then the bottom 2 were actually themes that only showed up in the female data. So I'll focus a little more on those. But also, of course, in exercise, none of the females said weight training or anything. It was more or less they wanted to do cardio, they wanted to run, and they wanted to tone, but not necessarily bulk. So this particular female said, now I need to get just more, I don't even know. I need to start really working out and getting toned. And that's what I need to like do to feel better about my body. Also, another female talked about her spiritual testimony and how it helped her get through. She had had some depression and anxiety related to her body image. And she said that, oh, it was definitely Bible studies, and it definitely was the Bible for sure. My faith got me through a lot. But the bottom two were the interesting two. Almost half of the females, when I was talking with them, you know, even though it was inadvertent and they didn't specifically say they avoided it, they just basically would say, well, you know, when my body image is bothering me, or when, you know, something changes, I just kind of try not to look at it. I don't really pay attention to it. And this particular female did say that this was kind of her coping mechanism. She said, usually my coping mechanism is just to try to not think about it, just ignore it, and then it's not there. And I didn't have, in this particular sample, there were no males that said anything about just avoiding it. Another very interesting theme that came through was education. I had multiple scenarios show up, and one of them being multiple females said that a big thing for them in terms of having a negative body image was going out in public and coughing. You know, they said, I go to school, you know, I go to a new college, I go to a restaurant, and when I cough, people stare at me, and it makes me feel like inferior about myself, makes me feel worse about myself. Another thing was they felt like they needed to educate others so that they didn't feel different. You know, they said, my body image is negative because I constantly feel different from others. This particular quote said, I feel like I'm pretty open about my CF, but in some ways I am, and in some ways I'm not. The people who need to know, like my boss, my coworkers, they know, but I don't want people to look at it as a disability. So I try not to think about it as that way either. So I had multiple scenarios in terms of schools and restaurants, but they just talked on and on and on about how when they felt bad in those situations, whether it be school or restaurants or, you know, where they felt different. One girl talked about how, you know, she had to get keys to elevators in the college because she could not walk up 5 flights of stairs to get to her class, and how people would look at her because she said, physically, I don't look like I have a disability, but I do need the key. And so people would kind of look at her funny when she got on the elevator. But a lot of them just kind of took ownership of it and said, when that happens to me, instead of letting it bother me so much and get me down on myself, I just educate people. I'll just say, you know, I have this condition and this is what it is and this is why I need it. And so I thought that was very interesting that women tended to just take the initiative, and that, you know, no social aspects of body image came up with males. So that was also very interesting. So just in terms of the quantitative data, just some conclusions. In terms of the quality of life questionnaire, no significant difference in body image between genders emerged. Like I said, it was very, very, very small. Males did report a slightly lower score, and that slight difference did persist in the interview data. But despite a poorer body image, males had lower rates of depression and anxiety, and I've discussed that a little earlier. In terms of concerns, the males' main concern was that they wanted to gain weight and be more muscular, whereas females were happy with being thin and viewed thinness as a positive effect of CF. Weight gain negatively affected their body image. Even though sometimes the weight gain made them healthier, they still didn't like it and weren't comfortable with it in terms of body image. Bloating was a concern, both pre and post-transplant for multiple women. And they were much more self-conscious about coughing and feeling like they were different. And that actually, you know, they said they kind of internalized that and felt worse about their body image because of social surroundings and social scenarios that had happened to them. So just in terms of, you know, what are shared between both genders, and that was spirituality and exercise. Both of them felt like that helped them a lot. They gave a lot of specific examples. But the very interesting thing in females, and I didn't really expect this, was, you know, the avoidance of the body image issues and the education, which I thought was also very interesting. And these are just some acknowledgments. And then I'll take questions if anybody has any.
Do we ask questions or write them? I forgot.
You can just ask them, and if you want, you can also put them in the chat box, and Molly and I can make sure to bring them up.
Okay, I wanted to ask Leanne, what were the age groups of the participants in this study, and where were they from?
So, for the most part, the average age was 31. We had a wide range of participants. I think the youngest was 19 and the oldest was actually 67, I believe. So it was a wide range. We actually included any genetic mutation. And so those were not different in any way. And they were all recruited from the University of Alabama at Birmingham, either in the inpatient setting or outpatient clinic. So all of them came to the UAB Center. There were participants, obviously, from multiple states, but they all came to UAB for care.
And it looks like we have a question from Kristen. She says, did you say where the CF questionnaire was developed or where it was taken from?
Yes, it was developed by Alexandria Quittner. She is actually, I believe it started off in Canada, and now it's been validated in the United States. And so actually they have it on their website, and you can actually just fill out a copyright and pull that from them.
Did you look at the prevalence of eating disorders at all in the CF populations? Or was it mentioned in any of the surveys?
So we didn't specifically look at eating disorders in any way. And actually in the interviews, I didn't have anybody mention having an eating disorder or bring up, any issues with that. But I also didn't specifically ask it either.
This is Laura. I have a question about pregnancy. What percentage of women said they are often asked if they're pregnant when they're not? I think that's something we don't even talk about.
I believe there were only 3 that mentioned that they had been asked before if they were pregnant, when it was actually just bloating. So 3 total out of 15.
I was asked that a lot before I knew I had CF.
I've been asked that many times.
Let's see, Kristen, do you want to ask your question?
Yes. Hi, can you hear me? I just typed it in there, but I was just noticing when you were listing the quantitative percentages and the difference among the males and females, I only noticed discrepancies in like the weight category domain and the emotional functioning. But can you just expand on what emotional functioning meant, or what types of questions were asked to deduct what that was?
Sure. So basically when they're asking about emotional functioning, it's basically just a few questions within the 50. And what it's asking is basically about worries or fears that they may have in day-to-day life that have to do with CF. So basically, what things do you worry about, or do you have any worries or fears related to your CF? And so that's what I basically, I included all of those domains in my interview questions. And so a lot of them, I asked them questions like, what does CF mean to you? And, emotionally, how have you functioned? And do you feel like having CF affects your emotional status in any way in terms of your day-to-day life?
I see, like anxiety, depression, those types of.
Correct.
Okay, thank you so much for the clarification.
Elizabeth also had a question in the chat box. Do you want to ask it, Elizabeth?
Sure. I'm just curious, how you see this research moving forward to be utilized either at CF clinics or where you would like this research to help improve or with care or just goals for it.
Yeah. So basically what I'm hoping to, like I said, there's a lot of data here for sure. So I'm going to have to narrow it down in terms of publications and things, but I definitely want to look at the different areas and some of the things that help people and some barriers that they've had in terms of eventually hoping that I can come up with some interventions, more specifically you know, probably to females, because there is such a disparity in quality of life for females. And of course, my long-term career goal would be to use this to eventually help the quality of life of females be equal to males. So this will obviously just be the base study for coming up with a much bigger study in hopes to eventually come up with some interventions. But I definitely am hoping to impact clinic and care for sure.
We've got a question from Jennifer Kyle in the chat box as well.
Hi, you want me to ask it?
Yeah, you want to ask it?
Okay, I asked if anyone interviewed said they were reluctant to go on Orkambi or Kalydeco due to the weight gain. Was anybody afraid of taking those medications just for that sole purpose?
No, no one mentioned not going on it for weight gain at all. I think that, you know, multiple women said that they knew that they might gain weight, but it didn't stop them from actually taking it. The one thing that came up in women in terms of the thing that stopped them from taking it was wanting to have children. There were a few women that said that, you know, the safety in pregnancy had not been well researched yet, and so they did not want to take it for that purpose. But no one mentioned weight as the specific purpose of them not taking it.
Okay, thank you.
You're welcome.
Eliza also has a question. So Eliza, you can unmute yourself to ask it.
I was wondering, I kind of want, like many women, CF or non-CF, when I hit around 38, 39, that time, I started gaining weight. Just felt like naturally. I didn't gain a lot. I gained a few pounds. And my question was, basically, are other women with CF noticing a weight gain as they hit their middle years?
So I had a good bit, while the average age was 31, I had a good bit of, I think 3 of the women that I interviewed were actually in their 40s. And so a good bit of them said that, you know, their weight and their weight gain bothered them when they were younger more so, but that as they had gotten older, they had gained weight, but they felt like everybody did. So it didn't bother them nearly as bad. So yes, I did have some mention that as well.
Linda's got a question she wants to ask next.
Hi, I'm wondering regarding the bigger study that you talked about, like when that would happen. And the reason I asked this is this, the study report is really surprising to me, to be honest, because the women that I know with CF and the men that I know, which is a considerable amount, doesn't jive with what these findings are. You know, I find that there's a lot of guys that are big and bulky and work out and feel good about themselves and they exercise a lot. And so I'm just wondering how big this study will get, because it feels like it's not inclusive of the majority of CF patients. I don't know.
Okay. I'm not sure if that I will redo this study, you know, with a bigger sample. I'll probably just take tidbits and things that probably more so in the domains that ended up being significant, probably dig into those a little deeper and do a bigger study on trying to develop potential interventions. But I don't think that I will redo this specific study with a very larger sample, just because I'll have to start out with something a little bit smaller once I graduate, trying to kind of establish a career trajectory. And so I'll probably have to start off with something super small and kind of build it up.
Okay, thank you.
No, you're welcome.
I have a couple of questions. First, for your patients that were overweight, how many did you have, and did they, because I'm overweight and I have a horrible body image because of it, and sometimes I know this is awful, but sometimes I wish I was skinny or a typical CF patient. Mm-hmm. Did they ever have anything like that? And the second question would be, what do you suspect some of the interventions could be?
So basically, I had a good bit. I would say that probably a third of the sample were actually overweight. So there was actually a good bit. Now I will say that obviously, because we included all genetic mutations, that the sample tended to be, let's just say I've done studies with double delta F508 only versus this one, and this sample was obviously much healthier. But basically, I did have multiple people, that were overweight, and they did talk about how their body image definitely correlated with being overweight and how that they wished they could lose weight. But in terms of potential interventions, I'm not totally finished analyzing all of the data in terms of the qualitative portion. So I'm hoping once that I finish full analyses and see the ones that tended to have higher frequency in terms of things that they feel like would help them in those significant 4 areas, I'm hoping that I can kind of pick a few and then build a study based on those. Did that answer your question?
Yeah, I was just curious if other overweight patients, if their body image was just about as bad as those who were underweight.
Actually, the ones who were overweight, their body image was actually worse overall because it included the females, and they tended to think their body image was great when they were more thin. So yes, I would definitely say overall, the heavier sample did tend to have a worse body image.
I think Laura had a question about pregnancy.
Hi, I'm so glad we're having this conversation. One of the things I wonder about is if you've followed women in the clinic who had, a good body image when they were with thinness and then became pregnant, and how that affected the care of themselves during pregnancy. Is that anything you've either observed or noticed in the research?
I actually have not. Now we did have multiple women included in the study who had actually multiple children. And one of them did mention that, she was super skinny prior to pregnancy, but because they felt like it was so important for her to eat so many calories, she mentioned trying to eat over 4,000 calories a day to gain the weight necessary for her child. And she said, and so since I've had my child, it's very hard for me to go back to my eating habits, and lose the weight, because now I'm used to eating these 4,000 calories. And so she did say that since she's had her child, which I think was around 18 months old, she's really struggled to kind of get that weight back off and adjust her eating habits to get her body image back to where it was before.
Do you think
that's the only instance that I'm personally familiar with.
Yeah, I wonder if women adjust their enzymes.
That would be interesting for sure. Yeah.
I wanted to offer to Eliza that there's a 10 to 20 pound typical weight gain in the perimenopause years. Sorry, everybody.
Let's see, Dr. Bray, I have a question kind of following up a little bit on the clinical implications.
Mm-hmm.
Did you ask, you saw a lot about depression and anxiety in both men and women. Did you ask if anyone was being treated with antidepressants for body image related issues and how the clinic helped address that depression?
So basically where I pulled a lot of the data, if they disclosed that they had anxiety or depression, most of the time it came out during that emotional functioning domain during the interview. So they've offered that information. Where I got the statistics for the anxiety and depression was the patient registry data. So I was able to pull whether or not they had been diagnosed with anxiety and or depression. But it did not show me specifically how that was treated. It just said it was listed under other complications, and it just showed basically that they had it. So I wasn't able to see their other medications that were not CF related. So I was able to see like their antibiotics and enzymes and things like that, but I couldn't see whether or not they were on a medication for anxiety or depression. Does that make sense?
Yes, it does. And then a follow-up, I know I've heard people mention that like their doctor prints out their weight charts and highlights overweight. Like, did anyone mention the clinician's role in contributing to negative body image or positive body image, either way?
So I had a lot of the people did mention their relationship with their care provider and how that did. So a lot of them said, I won't disclose certain things if I don't see the same consistent provider. So they said that was very important to them to kind of build trust, and that they had been in a care center prior where they kind of saw different people every time, and that they weren't always forthcoming with, you know, issues that they had or questions that they had because they just didn't feel comfortable. But there were a few that said that, you know, my provider did tell me that I need to lose weight, but they didn't link that to their body image. Does that answer your question?
Yes, it does. Thank you.
You're welcome.
This is Laura. I have a follow-up to that, and I wrote it in chat. But you know, I wonder, you know, that when you see a target body image for women, it's always the lower number for women with CF. We want you to get up to, and it's somewhere in the low 20s, I think. But for women who are overweight, I wonder if our target higher body image BMI is different than for the typical population. Yeah.
That would be interesting. The one thing that I did have, one female said that she was, you know, considered, you know, in the high overweight category. And she said that her physician told her that she could afford to lose 10 or 12 pounds, but that he would rather her be overweight than underweight. So he was actually more supportive of her being overweight than underweight, but he didn't say anything, you know, negative about that or anything. But that was the only thing that she touched base on in terms of that. She didn't tell me specific numbers that he wished that she was or anything like that.
My provider has done the same. He has never complained about my weight, and has, when I've talked about wanting to lose weight, they've said you can get down to this number, but we'd prefer you not get any lower than that. And they've been very good about, you know, if I do lose weight, they're very supportive. Yay, you've lost weight. But it's never been an issue that they have pushed with me. Even when I was, you know, considered obese, they've never discussed it, other than to say, don't lose too much.
This is Laura. I think it's so interesting how we're focused on this particular part of the conversation. You know, as women, and you know, living in the culture that we do. And in one of the quotes you had was about a man with scars on his body and a woman with scars, and they were, you know, negative and positive. But did you have much dialogue about the, you know, the condition of our bodies after, you know, living with CF for a long time, and how it might affect relationships, intimate relationships?
Actually, no. Now I did have, you know, them say whether or not, you know, the scars bothered them or not. And I had multiple say that their spouse or significant other is actually helped them be more comfortable. So I had a couple mention that when they first met their significant other, they were super hesitant to let them see their scars, but that, you know, the person that they stayed with was definitely supportive and made them feel better about that, if that answers your question.
Oh, well, it comes along with my work, and particularly family planning, and hoping that people protect themselves from pregnancy until they choose to become pregnant. And I just think that there's some relationship with body image and less effective contraception. But that's just in my thinking. So then I wonder if body image leads us in other ways now with CF, not to take care of ourselves in optimal ways. But it's really jaded by the history of the work that I did.
That's very interesting.
This is Kristen. To Laura's point, I know you mentioned scars, and I'm not sure whether you kind of included ports and G tubes and things like that in the scars category, because you know, I definitely delayed getting a port through my college years in the early 20s because I did not want that. You know, I'm really skinny, so I knew it would really protrude from my chest in a very evident way. So I was just wondering if that ever came up.
That actually did not come up, but I could definitely see where that could cause a big body image issue. And I know just in prior work with women who have cancer, that's also their big body image thing. So that would be interesting to ask for sure.
Yeah, and I would also ask about the role of the clinician. Like I'm very similar to Kristen. I delayed getting a port throughout high school, and I was finally convinced in college because an interventional radiologist approached me and was basically like, I get it. Come into the operating room with like I was a dancer, a ballerina, and I wore lots of leotards. So he's like, trace your leotards on your chest. I will put it in a place where it won't be seen in your leotard. And he put in an infant-sized port, which every single nurse still comments on. So part of me has anxiety of like, the next time I need to get a port, will I be able to convince the person to put an infant-sized one? But at this point, my swimsuit totally shows my port. I don't care at all. But I think it's because I had a clinician really listen to my concerns and take me seriously and address them.
Mm-hmm.
But yeah, so I think that would be a really interesting thing to study in the future.
Definitely.
So I think at this point, if anyone doesn't have any last questions, why don't we take a 5-minute break and then we'll come back into our breakout sessions.
I have one last question. It's an easy one. Are you going to present your research to others at the conferences?
I am. I'm actually, Dr. Ladoris and I are going to a nursing conference in Australia in July. And so that will be the first time that I presented at a conference. And then we're also planning to present some of the data at the North American CF conference this year.
Oh, wonderful. I hope this really gets people started talking about something that's so important.
Great.
Thank you.